Hello. If you're watching this video, it means that you've already seen the HIPAA security training on our new computer security online training course. You may have also watched the data protection video and the privacy video. These are the core of what it means to protect patient information, to protect the data we have here at CHA. This is a short video that's supplemental. It's information that's not contained in those other videos. First, it's important to know that patients are entitled to a copy of our privacy practices. We have these all over the place. It's on our website. It's at the concierge desk, and it's in all the waiting rooms. So make sure that patients have access to it, especially if someone asks for it, make sure they get a copy. The HIPAA privacy regulation gives patients all sorts of rights to their own information, rights to see it, rights to have access to it in the form they request, rights to make modifications to it. So there won't be a 100-question quiz on all of their rights, but it's important that you don't just say, no, you can't have access to that information. That's our medical record. It really is the patient's record. And if you have questions, please ask the HIPAA official in your area or talk to the HIPAA privacy officer or the security officer about getting this information, especially when it's a patient asking for access to their own records. The next topic, which is very important, is called breach notification. This is any time that we accidentally disclose a patient's information, no matter how small a piece of information it is, to the wrong person. So we have some examples here. If you accidentally put the wrong patient information on a prescription bottle, if you were to accidentally fax a form with patient information to the wrong fax number, or a really bad scenario is if you had a lot of patient information on a laptop, or even a little, and the laptop or your files are stolen. We have many policies that try and prevent this from happening, but we in healthcare organizations around the country have these breaches, hopefully very small ones, on a regular basis. So the most important thing is if you suspect that this has happened, you notify someone immediately. Tell your supervisor. Tell the HIPAA security officer, that's me. Tell the HIPAA privacy officer. They all need to know that we suspect a breach, that we inadvertently or intentionally or whatever happened, this is what happened to this patient's information. And the reason it's so important you tell us quickly is because there are requirements about notifying the patient, and if the breach is big enough, about notifying the public on our website, on the news, and there are penalties if we don't do that quickly. So it's very important. Now, if an employee here were to intentionally violate HIPAA, intentionally steal or use a patient's information, there are harsh criminal penalties and there are monetary penalties and jail time that come with that. There's also civil penalties. So those inadvertent violations, that laptop being stolen, CHA can be liable for fines, for paying to protect the identities of the people whose information is taken. It's very serious stuff. And again, the most important thing is if you ever suspect a breach or suspect somebody's doing something wrong with patient records, we need to know quickly. The next two slides are not something you will encounter very often in your duties at CHA. The first one is about business associates. A business associate is anyone who has access to PHI that's not for care of this patient. So if we're billing through a billing clearinghouse, that would be a business associate. If we have an IT vendor who has access to fix our systems, they have thereby access to our patient records. Anybody who has any kind of access to our records is a business associate and must have an agreement on file and must follow the same kind of security precautions that we follow here to protect our patients' data. If for some reason you think you're about to start sharing information with somebody new, stop. You need to talk to the HIPAA security officer, the HIPAA privacy officer. You need to make sure that we have a business associate agreement and that we're only providing access to our systems that's essential to a business function. Last but not least, there are also laws about genetic information and non-discrimination. Again, it's not something you'll commonly encounter, but be aware that it's against the law for people to use genetic information when underwriting a health insurance plan, or for an employee to use genetic information when deciding on hiring and other things. So just be aware of that. If for some reason someone requests genetic information, there's a whole other set of laws uh, keeping certain people from using it in certain ways. So it's kind of a red flag to be aware of. If you have any questions about this training and truly about anything to do with securing our patient records, Melissa Boloski, our current privacy officer, and Ryan McGee, our security officer, are always available to take those questions. You can email them, you can call us. It's very important that you be sure that you're doing what's necessary to protect our patient information. Thank you.